Hello and welcome to Triage, rapid legal lessons for busy healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
Hello, and welcome to this episode of Triage. I'm Rebecca Schaefer, a partner in K&L Gates Research Triangle Park office. My practice focuses on healthcare, regulatory, and transactional matters with a particular focus on supporting academic medical centers and universities, including their research programs. I am delighted today to be joined by my colleague, Karishma Page, who is partner and co-lead of our public policy and law practice. Karishma is joining us today to discuss the healthcare policy landscape with particular focus on implications for academic medical centers as we enter a new Congress and administration in 2021. Thank you so much for joining us today, Karishma.
So glad to be here with you. Thank you for the invite.
So it is obviously a dynamic time in Washington after Georgia's runoff elections, the events at the Capitol, and the inauguration. We saw as of day one a wave of executive activity from the new Biden administration. What do you think is ahead in terms of continued executive activity or on the regulatory front?
That's a great question, Rebecca. Similar to previous administrations, the Biden administration is already aggressively employing the executive pen. We saw this as early as day one. One of the first things President Joe Biden did post-inauguration was to halt Trump-backed regulations that were still working their way through the system. There was a memo that was circulated by the White House Chief of Staff, Ron Klain, that basically said that all rules, guidance, or agency actions that didn't take effect prior to noon on January 20th would be subject to review by the new administration before taking effect. And regulatory pauses like these are not unusual for new administrations. They really allow for incoming presidents to ensure that the unfinished policies from the prior administration align with the incoming team. Now, further, on January 28th, President Biden issued a series of executive orders on health care. There were three. The first was related to strengthening Medicaid and the Affordable Care Act. The second was related to improving and expanding access to care and treatments for COVID-19. And the third was preventing and combating discrimination on the basis of gender identity or sexual orientation. This is just the beginning. We really anticipate further executive action. For those Trump-era rules that may already be effective, the new administration is likely to consider rescinding or altering final rules by restarting the rulemaking process under the Administrative Procedures Act. And also, under the Congressional Review Act, a simple majority in both chambers could reverse rules issued by the Trump administration within 60 legislative days of the adjournment of the last Congress. And although the parliamentarian will have to decide the official date of the look-back period, it's estimated to be around August 21st, 2020.
Thank you, Karishma. Very helpful. And you mentioned executive orders on COVID-19. Going from that, obviously, along with the rest of the nation, AMCs, colleges, and universities are continuing to grapple with the health and economic impact of the pandemic. And President Biden has repeatedly emphasized that addressing COVID-19 will be one of his top priorities. Knowing you and the public policy team have been closely tracking the federal response to the pandemic, what can you tell us about President Biden's agenda and the possibility of a comprehensive COVID-19 package?
President Biden has outlined his priorities for the early stages of the administration. They are focused around continuing to address the COVID-19 pandemic, rebuilding our nation's economy, combating climate change, and promoting racial equity. President Biden has already started to work with congressional Democrats on a $1.9 trillion COVID-19 relief proposal. Now, of particular interest to academic medical centers and universities, the initial proposal would have created a vaccination program and scaled up testing, would have provided funds for the purchase of rapid tests, called for the investments to expand lab capacity, and providing other supports to help implement regular testing protocols. The proposal would also have delivered relief to individuals and their families in the form of additional economic impact payments and extending unemployment insurance programs and expanding access to child care and health care. And finally, the proposal was focused on supporting underserved communities that are struggling because of the pandemic. Now, congressional Democrats are making a push to advance a package along these lines. And Democrats have started using an expedited procedure known as reconciliation to help pass that package, which would allow the Senate to advance the package with only a simple majority. And with a 50-50 split in the Senate, Vice President Harris could provide the 51st vote, giving the Democrats the majorities that they need. Now, in parallel, there have been calls for bipartisan agreement, so that would require a 60-person majority in the Senate. Now, if the Democrats continue with the reconciliation process, it's important to know that there probably are going to be some limitations on what can be included, because moving forward with reconciliation, it really limits the package to include only provisions that have a budgetary effect and do not add to a budget window outside 10 years. So that's all to say there are some limitations, but this process has been used aggressively by majorities in the past to enact significant pieces of legislation.
Thank you. So switching gears a bit, recent projections have indicated the U.S. may face a shortage of approximately 140,000 physicians within the next 10 to 15 years. As part of the Consolidated Appropriations Act of 2021, passed right around the turn of the year, there were a series of provisions related to federal funding for graduate medical education that will have some impacts, at least to start, on addressing this physician shortage. Could you provide an overview of those measures?
Absolutely, Rebecca. As you mentioned, as part of last year's omnibus funding and COVID-19 relief package, Congress did expand the number of federally funded physician residency positions. Specifically, the legislation contained a number of provisions. First, it ended the nearly 25-year freeze on Medicare funding for GMEs. Second, the legislation added 200 new Medicare-funded GME positions per year over 5 years at both rural and urban teaching hospitals. Third, the legislation replaced the separate accreditation requirement, and instead, rural and urban hospitals that do not meet that requirement may work together to offer training programs aimed at increasing the number of physicians in rural areas. And then finally, the legislation allowed opportunities for certain hospitals with low GME caps to establish new caps in order to receive Medicare funding for GME programs that they seek to grow and enhance. Now, the legislation also allows for certain hospitals with a low PRA to establish a new PRA under existing methodologies applicable to new teaching hospitals. And finally, the bill also provides relief on the establishment of a new GME cap and PRAs for any hospitals until the hospital trained more than one FTE resident in a year. So now, particularly as we come out of the pandemic, there's likely going to be continued interest in policy developments around graduate medical education and the scarcity of medical professionals and the continued need by stakeholders to advocate before Congress helps shape that outcome is very much going to be needed to help ensure that policymakers are able to appropriately address the problem.
Also of keen interest to AMCs, do you anticipate further research-oriented funding, for example, along the lines of the 21st Century Cures Act that was enacted in 2016?
No, Rebecca, you had mentioned at the outset some of the key priorities of the administration. And one of the key themes or areas of focus is that this administration will be focused on the advancement of science. The Cures Act was designed to help accelerate medical product development and bring new innovations and advances to patients who needed them, and to do that faster and more efficiently. And you'll recall that it was then Vice President Biden's moonshot legislation, which was a legacy project in honor of his son, Beau Biden, that was included in the Cures Act. And that was an authorization of $1.8 billion over 7 years for cancer research, as well as $500 million over a decade for FDA to streamline drug and device approval processes. So certainly, as we think ahead in sort of the post-pandemic policy world, there is likely to be a renewed focus on funding research. In fact, there's already legislation that can be viewed as a starting point. In the previous Congress, Representatives Deget and Upton introduced bipartisan legislation known as Cures 2.0 Act. And that focused on a range of research and funding issues, including public health and pandemic preparedness, FDA modernization, and diversity in clinical trials.
That's a really helpful look around the corner. Thank you, Karishma. I have just one last question for you today. I have heard another area of focus for Biden's administration is on addressing social determinants of health. Can you share a bit more about that?
Absolutely. Rebecca, with the pandemic and even before, there has really been new understanding of how impactful the socioeconomic determinants of health are on health outcomes. And one of the things that I expect that we will see in the immediate term is a very strong focus on vulnerable communities and the focus on ensuring that health outcomes as it relates to COVID-19 and in terms of the ability to access vaccinations is going to be an immediate focus. Longer term, I anticipate that this really starts to get baked in, if you will, in all areas of focus on the healthcare system. We talked early on about the Biden administration's focus on racial equity, and I view that as a government-wide lens in terms of how the administration is going to be looking at policy and legislative priorities. And so I think this issue of socioeconomic determinants of health is really going to be at the forefront of their thinking.
Thank you, Karishma. That's really helpful. And thank you again overall for this truly informed perspective on what to expect in the healthcare public policy arena in 2021. So appreciate you being here today.
Thank you.
And thanks also to our listeners for tuning into this episode of Triage. Please, of course, do not hesitate to contact us if you have any questions.
Thanks again for listening to Triage, rapid legal lessons for busy healthcare professionals. New episodes are available for download through iTunes, Google Play, and other podcast applications. By subscribing to Triage, you will receive timely notifications of each new episode. Also, if you have any topics that you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.